So what's the difference between the phases of care in our office? So in our office, we've got acute care, corrective care, restorative care, and maintenance care or wellness care. And they all serve a different purpose. Now, if someone comes in and they've got a specific issue of pain that's keeping them from immediately doing the things that they need to do in their life, that's acute care. That's that first phase where we're trying to get the patient, help them get out of pain as quick as possible. But oftentimes that's a small portion of corrective care, meaning the reason why they're in as bad a shape as they are is because there's an underlying issue that needs to first be addressed and corrected. And that takes more repetition over time. So typically when a patient comes in and we're correcting a longer standing issue that's now showing up as a physical symptom, we often need to see them more regularly over a period of time, which could be anywhere from 3 to 6 months to correct that. Next phase of care would be restorative care. Restorative care is going to be where we don't necessarily need to see you as intensively as acute or corrective care, but we're also not ready to maintain where you're at. So it's kind of like a hybrid in between that we use objective ways of measuring if you're ready for that phase, which then leads us into wellness or maintenance care, which then maintains all the changes you've made in those other phases of care to help keep you from going back to that starting point and keeping you more likely to have less flare-ups and just functioning and feeling your best as often as possible.